In 2022, Arizona saw a significant increase in new HIV infections, rates that our state hadn't seen since the 90s. Now, an ASU researcher is helping the city of Phoenix through a global initiative to end the HIV epidemic by the year 2030. Angel Algarin joins us now. He's an assistant professor with the Edson School of Nursing and Health Innovation. Thanks for joining us.
Thanks for having me.
Hey, let's start with the initiative. The Fast Track Cities Initiative is a global initiative, and you were recently appointed to the city's ad hoc committee. So can you explain the initiative first?
Yeah, so the initiative really brings together state, academic, community partners to talk about different solutions to how we can end the HIV epidemic in our respective cities. And so we really focus on testing, HIV testing, trying to get people to 90% of folks knowing their HIV status, 90% of those who are HIV positive on antiretroviral therapy, and then 90% of those that are virally suppressed. And then the last one is our Zero Stigma campaign, meaning to have no stigma that's occurring against people living with HIV.
So you mentioned 90% 3 times. Do you know where Phoenix falls or Arizona falls in relation? Because I got on the dashboard, and granted, I didn't spend a lot of time on it, but I couldn't necessarily find a lot of numbers.
Yeah, so it's looking pretty bleak in reaching that 90%, but I'm always optimistic in finding new solutions. But for our viral suppression, it's only a little bit over 50%. I think it's actually 56%.
Why did you want to be involved in the committee?
Yeah, so I wanted to be involved in the committee because ever since I was a kid growing up in a small rural town as a gay Latino, I was told that gay folks acquire HIV, and that's part of what happens. And I wanted to fight that stigma. I knew that that wasn't necessarily true. And in every community that I've been a part of, the Academy has taken me to many different places, from Lexington, Kentucky, to Miami, Florida, to San Diego, now here in Arizona. I know that the best way to be able to fight the HIV epidemic is reaching out to our local communities and understanding what's going on.
So when you say reaching out, and when we talk about the committee's work, because, you know, we often hear that, community outreach and service, and I'm like, what does that mean? Like, can you give an example, something that's tangible that I can visualize, or all of us can?
Yeah, so as part of my work at Arizona State University, I have my lab, which is a stigma and HIV-related health lab. And in the state, actually, the only sort of statistics that they're capturing on HIV are, the number of new cases and what these cases look like, how they're transmitted, and then for people living with HIV, where they fall on that HIV cascade of whether they're virally suppressed. But they don't really talk about these behavioral aspects. And so we have worked with folks over at Emory University who do the American Men's Internet Survey yearly, which is an online survey that's completely online among men who have sex with men, which is the highest risk population. And what we did actually is we looked at specifically the statistics around our Arizona men who have sex with men. And so we compiled one-page reports and a full report that is accessible on our website that people can access free of charge. And so you can see a better picture. And so we have been spreading that through our social media campaigns. We've been spreading that through different speaking engagements over at 1 in 10, but really reaching out to the community where they're at.
What would you say to people who maybe do not feel directly impacted by HIV or AIDS? What would you say to them for them to care about the initiative and maybe want to support it?
Yeah, so you might not be directly affected by HIV or may not be engaging in HIV risk behaviors, but somebody you know and love may be engaging in those sorts of behaviors. So the more you equip yourself with that knowledge, the more you can prepare maybe that person you know and love with that knowledge to prevent them from acquiring HIV.
Where can people get more information about either the work that you're doing or the Fast Track Cities initiative? Yeah,
so they can go to my lab website. It's shhhlab.com, or they can follow us on Instagram. The initiative, you can go on the city's website, but there's a plethora of information that you could plug in right into Google and get connected to resources if you're interested in pre-exposure prophylaxis, which is a pill that you could take once a day to prevent the acquisition of HIV. And for everybody out there, the CDC recommends at least one lifetime test of HIV. So if you haven't gotten that HIV test, maybe now's the right time.
Angel Agron, thank you so much for coming in. And how long are you on the committee? What's the term?
The term, I'm not quite sure yet, but until they kick me off.
Maybe a long time. You've got lots of energy.
Yeah.
Thank you so much.
Thank you for
coming
having
in.
me.
Appreciate it.